This is part 3 of my NG checkoff with enteral feeding. So to begin, I'm going to verify my orders, check the expiration date of the feeding that Mr. Smith is supposed to be receiving, and I'm going to identify my patient. I will provide for privacy, wash my hands, not before entering, all of that stuff before going into the room. So I'm going to identify my patient. Can you tell me your name and date of birth? Mr. Smith, 12/18/62. Okay. Mr. Smith, we're going to be doing a continuous feed on you today, and we're just going to kind of check your placement of your tubing, and so that we can get you started. And to do that, he could either have an NG tube or a gastronomy tube. For either one, you're going to want to make sure that you're checking for placement. So with the NG, you will check for the black line that's been marked, and for the gastronomy tube, even though it's a lot shorter, you will still be able to measure to make sure that you are still going to have correct placement. What you're going to want to make sure you do is have correct placement. So by doing that, you will check for aspirate, and you will put on your gloves and wash your hands. And you will check the aspirate and the pH to make sure you are still in the correct area. You don't want to put feeding into the lungs. So you would do that just how you would do anything. You would take about 30 milliliters out and test the pH for residual, and per facility policy, you could put that back in. After that, I would do a focused abdominal assessment and go over and verify my orders once again with the kangaroo machine. And since he is getting a continuous feed, I would program it to 30 milliliters an hour, or whatever the order says. He can have a open feed or closed feed. With a closed feed, they are good for about 92 hours, and with an open feed that you have to pour in, they're good for about 24 hours. So after verifying that everything is correct and that the expiration dates are fine, I will come over to the kangaroo pump, and you set it up just like you would with an IV, and you go ahead and type in the rate that you want it instilled. So we're just going to say 30 milliliters an hour is what was on the order. And since he is already got his tubing, you'll just connect them, and before you connect them, you'll prime the tubing, and once it's primed, you'll be able to connect them. And after that, you will just check on Mr. Smith periodically per facility policy, and that could be, it's usually like every 4 hours, but it depends. As well as you will check for aspirate every 4 hours or per facility policy. Some facilities have you instill water just to flush the tubing, so that's all based on your facility that you work at. And after that, you're just gonna periodically check for discomfort, vomiting, distension, if he feels nauseous or just doesn't feel good, and you'll just do your assessments and document your findings. That's it.